welcome to the Waterbirth class for the McKenzie Midwives. My name is Annie Zimba. I'm one of our nurse midwives. We have asked that our patients take this class because we feel that Waterbirth requires really good communication between the birthing person and their birth team. And so we want to ensure that our patients have a little extra education when they're choosing Waterbirth. We're so excited to offer this and really look forward to laboring with you. We serve Lane County and a little further if you want to come see us. We have consults available if you're not already our patient and have found your way here and would like to be. And otherwise, if you are with us already and interested in a Waterbirth, congratulations, you have found the required class and thank you for being here. I was just looking through my books at home trying to find some good images of Waterbirth. And I found in The Birth Partner by Penny Simkin, which is one of my favorite kind of 101s for labor and birth books, just some nice pictures of someone in the shower, someone in a big birth tub, someone in a little kind of typical hospital tub, and then an image of someone in the tub with their partner with them, with a monitor on. So this is a great little 101 if anyone's looking for a good book. So what is Waterbirth, first of all? Waterbirth is different from laboring in the tub, which a lot of people do and have heard of, but Waterbirth is where you actually deliver your baby in the tub. Waterbirth is associated with increased satisfaction and pain relief, reduced use of medications for pain, operative birth, episiotomy, and severe perineal trauma. A big benefit is really the experience. In the tub, you're surrounded by your birth team, by your care team, and yet you're able to float, to move freely, and enjoy the benefits of a safe and often more hands-off mode of delivery. There are no pain medications available while you're in the water, and this is important to understand. The water provides pain relief for most people, and most people who desire a water birth are interested in a physiologic and likely unmedicated birth anyway. But if your plans change, your mind changes, your birth changes, you can always get out of the tub and change to a land birth and use all of the things normally available in the hospital as well. A common question about water birth is it safe? The short answer is yes, for low-risk pregnancies. We'll talk about our risk criteria in a few minutes, but kind of overall, water birth does not negatively change neonatal outcomes. There's no increased risk for infection, NICU admissions, or mortality, and though rates of cord avulsion, where the cord snaps and needs immediate clamping, haven't been studied in terms of how often they happen with land births, we do know that they happen in about 2.4 out of every 1,000 water births. This is something that we can quickly address medically, and we do have a plan in place for that. So who can have a water birth with McKenzie Midwives? Our requirements are pretty basic, that you have a single fetus, no twins, you're between 37 and 42 weeks, that the baby's head down, that you have a category 1 fetal heart rate tracing, which means that we have reason to believe a reassuring fetal status, and that the parent has stable vital signs and no fever. And then what would be contraindications? So any condition requiring you to have continuous electronic fetal monitoring. So if there's a reason that you are being induced, for instance, or have complications with your pregnancy that require really close monitoring, that would not be safe in a water birth. Category 2 or 3 tracings, which I know I mentioned category 1 tracing earlier. These are medical categories that we keep track of and we will communicate with you about. Basically, it's to say that we have ways of listening to baby to make sure that baby is doing well. If we have reason to believe that there's something concerning going on, some stress, we will be asking you to get out of the tub. Other contraindications are abnormal vaginal bleeding, a fever, an untreated skin infection, HIV, hepatitis C or hepatitis B, any musculoskeletal problems that limit your mobility, recent diarrheal illness, having an epidural, having used IV pain medications in the last 2 hours, having used nitrous oxide within the last 15 minutes, a history of shoulder dystocia, a history of a postpartum hemorrhage that required transfusion or surgery, meconium-stained fluid, a pre-pregnancy body mass index that was 40 or greater, an estimated fetal weight of 4,500 grams or greater, and certain uterine surgeries. So how do we monitor the baby? As I mentioned, during a water birth, we typically use intermittent auscultation. So instead of the continuous fetal monitoring that you might be familiar with in the hospital, a recommended standard for low-risk pregnancies is to listen intermittently, and there's a protocol for how we do that. We typically listen every 30 minutes in active labor, and we listen more frequently while you're pushing, and we'll listen before, during, and after a contraction. So when you're in the tub, that's what we would do. And this is important to know because this is another part of reestablishing that you continue to be low risk, and so does your baby. And if there's something that is of concern, we will ask you to get in the tub. And when you come to the hospital or maybe prenatally, we'll have you sign a consent that just kind of goes into more detail about this and says that you agree to that and to work with us if we have any concerns. So what are the possible risks? The risks are the baby taking a breath underwater, a brief delay in the midwife's ability to treat an emergency as we relocate, a cord avulsion, and a waterborne infection. So we talked about the cord avulsion, the cord snapping. Waterborne infection is highly unlikely, but of course it could happen. You will be receiving clean, sterile, and new equipment during your water birth. The tubs are reusable but sterilized between use, and the liner is fresh for each patient. There is, of course, potentially a brief delay in our ability to treat an emergency unfolding as we move from the tub to the bed. That would be a brief delay that we would be communicating about, but it is possible. And then in terms of babies taking a breath underwater, they are born with a reflex that prevents them from breathing until their skin hits that cool air. Though, of course, it's also possible that that could be interrupted. It's extremely unlikely. One more word on safety. When you're having a water birth in the hospital, all of the usual services would still be available. So if something's going on that we're concerned about, we're pulling you out of the tub, we're able to call the pediatricians, the obstetricians, extra hands, all the services that we normally would be able to if we need to. So as long as there's been proper screening and that ongoing risk assessment, which is our job, water birth is considered safe. And each of us have experience providing this option and are so excited to be offering it again. So now that we covered some of those details, let's talk a little bit about what to expect for your actual experience of water birth. That's different for everybody, of course, and labor is different for everybody. But generally speaking, it's most beneficial to get into the tub once you're already in active labor, so you're having regular, efficient contractions. Sometimes getting into the water before active labor can almost be too relaxing, but it's different for everyone, and you can use the tub whenever works for you. The tubs have soft walls and an inflated floor and a little seat so you can move about, float, change positions. You can get out and go to the bathroom, come back in, and the staff will listen to the baby at appropriate intervals, come and take your vital signs, all around you being in the tub. Pushing is also different for everyone, so it's a little different what to expect in terms of the nitty-gritty of pushing. However, generally in the tub, people tend to be on their hands and knees or kind of holding the sides with their legs a little bit elevated or their hips a little bit elevated. We do want to keep your hips under the water. It's very important that the baby be completely born in or out of the water, not a little bit of each. So we will help you to keep your hips in the water. Typically the baby's head comes out with one contraction, there's a pause until the next contraction, and then you deliver the rest of the body. Generally then you and or the midwife, we will promptly bring baby out of the water, safely up to your chest, into your arms. Baby likes to stay warm with their body mostly in the water, or warm wet cloths being placed on them. Their head, of course, needs to be out of the water. And then we move to the bed generally to deliver the placenta, and so you'll hold your baby and we'll all assist you with that move. So if you're looking for more information about water birth, I would highly encourage you to check out videos and do some research. Waterbirth.org is a website that has some more FAQs and articles and information. They don't have videos that you can stream, but some that you can purchase. And then there's a website called mamanatural.com/waterbirth, /water-birth-videos/ and there's 10 videos there. That's a little collection of water birth videos that might be a nice place to start. Some of them are home births, but those blue squishy tubs are the same ones we have, so it'll give you a pretty realistic idea of what it would look like. So our big takeaways are that there are risk criteria for water birth. These are important for your safety, and we use those in every aspect of midwifery care. It's important to us that we have good, clear communication with you during labor and water birth, and we want to be a team with you if any complications arise. That really just means that if we're asking you to get out of the tub, it's because it really is important for you and or your baby's safety. We would not ask you to leave that cocoon if it wasn't really important. So we just want to have a good agreement about that with you and everyone on the team when we're embarking on this. Water birth is a really lovely, pain-relieving, gentle, physiologic way to give birth. In that vein, I'd highly encourage that you check out some education specific to physiologic birth and water birth. Watch videos, seek out childbirth prep classes that are really preparing you for physiologic birth in addition to a hospital prep birth class. And if you have any questions about that, just let us know. And now that you've done this class, thank you so much for completing this. Next time we see you in the office, please let us know. We can check this off your list. We can do any other screenings that we need to do and make sure that everything is ready for you. And we also want to thank our nurse managers and all of the nurses at McKenzie Willamette for making this possible for our patients. All right, thanks so much. Bye.